Aminoglycosides. Aminoglycosides are a class of antibiotics that are primarily used to treat severe bacterial infections. They are derived from various species of soil bacteria, including Streptomyces and Micromonospora. Aminoglycosides are known for their bactericidal activity, meaning they kill bacteria rather than just inhibiting their growth. Mechanism of action. Aminoglycosides work by inhibiting bacterial protein synthesis. They bind irreversibly to the 30S subunit of the bacterial ribosome, specifically to the 16S rRNA component. This binding disrupts the normal functioning of the ribosome, leading to the production of abnormal and non-functional proteins. Ultimately, this disruption causes bacterial cell death. Spectrum of activity. Aminoglycosides are mainly active against aerobic gram-negative bacteria. They are particularly effective against Enterobacteriaceae ae, for example, Escherichia coli, Klebsiella pneumoniae, Proteus species, Pseudomonas aeruginosa, and Acinetobacter baumannii. Some aminoglycosides, such as streptomycin, also have activity against certain gram-positive bacteria, including Mycobacterium tuberculosis. Clinical uses. Aminoglycosides are commonly used for the treatment of severe infections caused by susceptible bacteria. They are often reserved for infections that are resistant to other antibiotics or for infections caused by multi-drug-resistant organisms. Some specific clinical uses include 1. Severe systemic infections. Aminoglycosides are used to treat serious infections like bloodstream infections, sepsis, pneumonia, intra-abdominal infections, urinary tract infections, and bone and joint infections. 2. Tuberculosis. Streptomycin, an aminoglycoside, is one of the first-line drugs used in combination with other antibiotics for the treatment of drug-susceptible tuberculosis. 3. Endocarditis. In combination with other antibiotics, aminoglycosides are sometimes used to treat infective endocarditis, an infection of the heart valves. 4. Cystic fibrosis. Aminoglycosides may be administered via inhalation in patients with cystic fibrosis to treat chronic lung infections caused by Pseudomonas aeruginosa. Administration and pharmacokinetics. Aminoglycosides are typically administered intravenously or intramuscularly, as they are poorly absorbed from the gastrointestinal tract. Due to their poor oral absorption, they are not commonly used for oral administration. Aminoglycosides have significant pharmacokinetic characteristics that influence their dosing and monitoring. 1. Post-antibiotic effect. Aminoglycosides have a prolonged effect on bacteria, even after their serum concentrations fall below the minimum inhibitory concentration, MIC. This allows for less frequent dosing, typically once or twice daily. 2. Concentration-dependent killing. The bactericidal activity of aminoglycosides is concentration-dependent, meaning higher drug concentrations result in more effective bacterial killing. Therefore, dosing strategies aim to achieve peak serum concentrations that are several times higher than the MIC. 3. Renal clearance. Aminoglycosides are primarily eliminated by the kidneys. Therefore, dosing adjustments are required in patients with impaired renal function to prevent toxic levels of the drug. Side effects and precautions. Aminoglycosides can have significant side effects and require careful monitoring. 1. Nephrotoxicity. Aminoglycosides can cause kidney damage, especially when used at high doses or for prolonged periods. Monitoring of kidney function, including serum creatinine and urine output, is essential during treatment. 2. Ototoxicity. Aminoglycosides can cause damage to the inner ear, leading to irreversible hearing loss or balance problems. Monitoring of auditory function may be necessary during therapy, especially in patients receiving high doses or with pre-existing hearing impairment. 3. Neuromuscular blockade. Aminoglycosides can interfere with neuromuscular transmission, leading to muscle weakness or paralysis. This effect is more likely to occur in patients with underlying neuromuscular disorders or when aminoglycosides are used in combination with certain other medications, such as muscle relaxants. 4. Allergic reactions. Some individuals may experience allergic reactions to aminoglycosides, ranging from mild skin rashes to severe hypersensitivity reactions, like anaphylaxis. 5. Drug interactions. Aminoglycosides can interact with other medications, such as diuretics and certain antibiotics, potentially increasing the risk of kidney or ear toxicity. Close monitoring and dose adjustments may be necessary when using aminoglycosides in combination with other drugs. It's important to follow the prescribed dosage and duration of aminoglycoside therapy and to consult with a healthcare professional for accurate diagnosis, appropriate antibiotic selection, and monitoring during treatment.